Can everybody hear me okay? All right. So as Dr. Bender said, I'm your neighbor to the south, but I actually was born in Minnesota because I grew up in a really rural area, and that was the closest hospital to our house. So I consider myself a hybrid, and I am a diehard Minnesota Twins fan, which we're all super excited today because they clinched the division last night. So I was listening to Paul Allen the whole way up here to talk to the Minnesota Twins players. So we don't get that radio in Iowa, so I have to drive up here to listen to the Twins. So I'm going to kick us off today. Speaking briefly, we don't each have a lot of time. I'm going to leave time for questions at the end, but just going to start with a brief background on antimicrobial resistance to make sure that we're all on the same page. I know this will be review for a lot of you. And then I'm going to talk a little bit about our new institute, our work there, and then hopefully interest some of you in getting involved in some of the work that we're doing there as well. So antimicrobial resistance happens when germs, like bacteria and fungi, develop the ability to defeat the drugs that are designed to kill them. And the big issue is that bacteria are developing the resistance faster than we're developing new antibiotics or other alternatives to be able to manage this issue. So AMR is shared between humans, animals, and the environment. Some recent examples in the news. Some of you may have seen that the EPA recently approved spraying of large pieces of land down in Florida for citrus screening disease. The environmental piece often goes overlooked. We hear a lot about the livestock piece of antimicrobial resistance in the media, human health, particularly in our long-term care facilities and things like that. Companion animals are kind of an up-and-coming topic. My background outside of public health is in companion animal practice, and so that's kind of near and dear to my heart. Those often get overlooked when we're talking about AMR, but I think it's something that's going to be coming up more and more, and was highlighted in the National Action Plan that was just released, the first draft of it for 2020 to 2025 by PACCARB. Does have a large focus on companion animals. But as can be seen here, this truly is a One Health issue. So we truly do have an impact here on humans, animals, and the environment, and all of the different environments and ways that we can share those back and forth between our food, both plants and meat, and then companion animals as well. So solutions to the AMR crisis, there's many. It's a multifaceted problem that's going to require multifaceted solutions, and so that's why we need everybody working together in this space across the One Health spectrum. No one person has the single expertise that it's going to take to solve this problem, and so we really need to pool our resources, pool our expertise to make an impact. And we are truly making some progress, but definitely still have a long ways to go. So the three things I wanted to highlight here. The development of new antibiotics and alternatives to antibiotics is going to be an important solution to the AMR crisis. Also, improving how antibiotics are currently used. So using them judiciously at the right dose, at the right time, for the right duration, choosing the right drug. And then focusing on AMR transmission prevention. So how do we prevent that from happening in the first place so that we're not seeing as much of it to start with? So I'm going to give just some brief background on the Institute here. This name was bestowed upon us, so I apologize for its length. I also have still difficulty saying it, and I've been saying it every day for 9 months. But it's the National Institute of Antimicrobial Resistance Research and Education. And it's hosted at Iowa State University, and the funds to start this institute were provided originally by the University of Nebraska-Lincoln and Iowa State University. But that being said, as you can see here, we don't brand this institute Iowa State, and that's done very intentionally. We truly want this to be a national institute, a collaborative effort. I'm going to talk here a little bit about what we're doing, and then truly hope that after the discussion here today, if any of you are interested in possible collaborative activities, we would love to chat with you more about that. So just a brief background on our story. In 2015, Iowa State established a regional antimicrobial resistance consortium, and that was housed on the Iowa State campus and involved all of the colleges at Iowa State except for the College of Design. They are involved now, but so we were pulling people in from engineering, the College of Agriculture, the College of Veterinary Medicine, And that group was truly growing and collaborative and really spanning those different sectors across the university campus. That eventually came to be under the direction of Dr. Paul Plummer, who is the director of the National Institute of Antimicrobial Resistance Research and Education, which I'm going to start referring to as NIAMRE from here on out. That's how we say our acronym. But in April of 2018, the American Association of Veterinary Medical Colleges and the Association of Public and Land-Grant Universities requested proposals to host a new national institute. And that came about after many meetings that they had identifying, just looking at this problem of antimicrobial resistance and then what could possibly be done to truly have an impact on it. And so the results of that was that they felt there needed to be an institute, a national institute dedicated to working across the One Health spectrum on antimicrobial resistance. And so 9 different academic institutions from across the country, many of whom were their own consortiums, and our application was under Iowa State, but it was truly a consortium approach. So University of Nebraska-Lincoln had joined those efforts at that time, Mayo Health Clinic, University of Iowa, and the University of Nebraska Medical Center, and USDA also played a role in that. And so together they applied, and in July of 2018, they were selected as the host for the institute. So that being said, like I mentioned before, the host institute, that didn't come with any funding. And so the funding was provided initially by Iowa State and the University of Nebraska-Lincoln. So that was formed initially in July of last year, so we're just a little over a year old. In November of 2018, we formed our Interim Executive Advisory Council. I'm going to show you some of the folks that are on that. And we're going to be electing a new council here shortly. And then by January, we had our key staff hired out at the Institute. I was the last one to come on board and started January 1st of this year. So the mission of the Institute is to truly drive cross-sector engagement and coordinated action to combat the global threat of AMR across that One Health spectrum. So truly taking into account humans, animals, and the environment. The values, this was an early discussion that we had. We truly wanted to be ethical, transparent, evidence-based, all these things that you see listed here. Innovative, collaborative, excuse me, action-oriented and objective. We do try to follow these values in all that we do, and part of that is trying to take that truly collaborative approach. And so one of the early things that we did after we were announced as hosts of the Institute was to reach back out to all of the consortiums that had applied to host the Institute as in that same process that Iowa State had applied in. And so we're trying to engage, and the reason we chose those schools and those consortiums was because they have demonstrated capacity already in the antimicrobial resistance space, but certainly there's a lot of other folks working on this across the country too. But we did a dedicated reach out to those universities and consortiums, and many have joined our efforts, and so that's kind of our original focus. I'm afraid this is going to fall off here, but that's kind of our original focus is this academic approach with the intent that as we continue to roll this out, and we've had early discussions, but to bring in industry, government, the nonprofit sector, and then truly make this kind of a public-private partnership is where we're headed. So we have 4 primary focus areas. Research certainly being one of them. We don't have a benchtop lab facility. Our office is located out at the Iowa State Research Park, also intentional because we want to be able to bring external stakeholders in easily. Originally, the Institute was going to be housed at the Veterinary College, but the parking situation out there is very complex, as I'm sure those of you from Minnesota can understand. The doors are locked, so it's hard for people to get in. So the research park was just an area where we have our own entrance, people can come and go. It also helped to kind of separate us a bit from, again, branding ourselves Iowa State and take a little more collaborative approach, an inclusive approach. And so we're out at the research park. We don't have a benchtop lab facility, but what we see our role being in the research space is doing some resource mapping to find out what folks are already working on, identifying some gaps of what we need, and then helping to pull people together, new teams together to be more collaborative, better leverage our resources, and make us more competitive out in that applying for research funding. The education piece is near and dear to my heart just because of my background. So we see that as being educating legislators, policymakers, and then also educating prescribers. And of course, I was lucky enough to attend the AMR Learning Site review with Dr. Bender and a great group of other folks earlier this year. That's a huge, wonderful resource about antimicrobial resistance, and so we want to be able to highlight things like that, not replace them certainly, but continue to collaborate, build on those things, and hope to make them better known out to our stakeholders. So collaboration, you keep hearing me say that. We have that listed here separately because we truly want to serve as a convener, bringing people together. One of the ideas we've had is to possibly do some One Health tours. So to possibly try to get some veterinarians to be going into some human healthcare facilities and vice versa, just to help learn from each other. I just came back Tuesday night from New York City and was able to attend the CDC Global AMR Challenge event. That was a side event to the UN General Assembly. And I can tell you from being there, it was a wonderful experience, but there's still a lot of education or opportunities for education in our different sectors and learning more about what we do in human, animal, and environmental health. And then advocacy is a huge component of what we do as well. So we spend a lot of time in Washington, D.C. Advocating for increased funds, educating policymakers and legislators, like I said, and then trying to get more funding for research and education efforts in the AMR space. So you guys can read these. I'm not going to go over them due to time, but this is who's currently serving on our Interim Executive Advisory Council. We've got folks here from UNL, Iowa State, of course, and then people from George Washington University. Kathy Witecki was the former USDA Undersecretary. Robin Patel's a partner. She's now the president of the American Society for Microbiology. And then Lonnie King, many of you know, I'm sure he's the former dean at Ohio State, and also the co-chair of PACCARP. This is our staff, Dr. Paul Plummer, the executive director, myself, associate director, and then we have Valen Bodensteiner. She's our incredibly talented marketing and communications specialist, and Erica Helmick is our administrative specialist. So we just have a small group, core group of people working out at the office. This is our office space out at the research park. You can see our website listed there, and I also have cards. I'd love to talk with you afterwards more about what we're doing, and if any of you are interested in possibly collaborating. Right now we're doing a lot of reach outs. We've been traveling all over. I'm going to Illinois in a couple of weeks to visit with some of the folks at the University of Illinois, but we would be more than happy to make a trip up here, hold a Zoom meeting to talk with you further about any areas where you think you might want to collaborate. So that's all I have.